UK dementia care crisis. Families have been hit with £51,000 a year's bill. We're going to read into this exclusive from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from iNews with the headline of the UK's dementia care crisis. Families have been hit with £51,000 a year bills. Relatives are shouldering 63% of all dementia costs. New research is revealed. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. 63% of dementia costs. Now, I know I had a relative of mine who is no longer with us, who went through the last year or two with dementia. And luckily for us, there was, I believe they went, from my knowledge, we went into private care. Now, I don't recall the cost of it because it wasn't, it was family sort of thing. So I don't know the true cost of it. But they had pretty good, decent care under them. But while obviously everyone's situation is different, I remember the last time I saw that person, and and they were in a hospital bed, and they had no memory whatsoever of me and my relatives around the hospital bed. And in comparison to knowing like the history and everything, it was very sad for me. It was the first time in my life that actually there was a family member that I knew who was suffering from dementia, and they've completely forgotten who they was and who they're talking to. And it's very depressing. It's very depressing for me. And I think anyone who suffers from dementia, I think it's a terrible, terrible thing. And then more needs to be done to tackle dementia. More needs to be done on the world stage, not just here in the UK, but in terms of the world, because it's a terrible way. For me, it's a horrible way to live out the last of your years in life. To live like that, not knowing, to live in such a state of mind, to not know your history, and for the person who cares for them and loves them so much, who goes out of their way in the efforts and the money and the sacrifice that they make for their loved one, only for that person not to remember the most important memories. It's incredibly heartbreaking. It really, really is. And it's an enormous amount of psychological mentality that it comes on that person as well. When you really think about it, how difficult it is, And there are points where there are times where with that person, certain impulses and certain memories get triggered by certain actions or words that you could or can be on certain dementia people. But it's bringing them back from it is almost near to next impossible. It's pretty much sucks, to say the least. Which brings me to this article, guys, and I generally want to ask you this question: is it right that people pay out to look after their loved ones with dementia in any way, shape, or form? Should it be a case that it should be down to the state should look after to do more to look after this? Should it be down to the NHS doing more to help? Because here they're saying 63% of all dementia, 63% relatives are shouldering. Is that fair? Should it be much less? Should the state be paying for all of it? These are difficult questions. Now, obviously, there's private social care. It's obviously the care centres. Obviously, you can put them in, which can look after them for you, but at a cost of you, out of your pocket. Is that right, though? These are questions that I think are worth debating on when it comes to this kind of care. We talk about healthcare being a human right, your human right to to be able to have a clean bill of health, so you'll be able to work and contribute to society. But like everything, it all costs money. It's how you pay that cost. And the way we pay our costs here in the UK is that we all contribute in forms of taxes to the National Healthcare Service, such as the national contribution. But should it come out of people's pockets instead? No, I personally, I don't think it should. I generally believe that healthcare is a human right that everyone should be given, and I think the state could do more to them. But as of right now, and let's be serious, we know the healthcare is in a crisis. Make no mistakes about it. But could a future Labour government do something about this crisis? And if so, what would their plans be? Because as of right now, we know the Conservatives don't give a damn. So it's a lot of food for thought when it comes to helping people with dementia care. So families are being forced to give up the equivalent of £51,000 a year on average to look after a loved one with dementia, according to new research. Commissioned by the Alzheimer Society, they do great work. A study into the economic impact of the disease has found that relatives are shouldering 63% of all dementia costs, either in unpaid care or in paying for private social care. The total cost of dementia in the UK has now reached a staggering £42 billion per year. £42 billion. That's equivalent to a quarter of the NHS England's entire budget for 2024-2025. Think of where £42 billion a year. Think of what we could do if we could cure dementia with that money. But unless urgent action is taken, this figure is set to rise to 90 billion, the charity says. 90 billion. Where the hell? Where are we going to afford 90 billion? Oh my God, that's insane. If true, anyway. And anyone who knows about Alzheimer's is the Alzheimer Society. That's insane if that's true. That works out an average cost of £29,000 a year for people with mild dementia, rising as the disease progresses to £81,000 per year for the care of people with the most severe forms of dementia. Who here lives on 80 plus thousand a year? Hard enough on £29,000 a year. That's impossible. That's impossible for people. The Alzheimer Society said that the total cost of people living with dementia, care for people living with dementia, can be as much as £500,000. Published to coincide with the start of Dementia Action Week today, the Society's research looks at the records of 26,000 people across a 7-year period and revealed that the disease progresses, its total costs rise. It is one of the largest UK studies in the economic impact of dementia, using real-world healthcare data, which gives more accurate picture of cost than has been done previously. Kate Lee, Alzheimer's Society Chief Executive, said dementia's devastating impact is colossal on the lives of those it affects, on the healthcare system and on the economy. Now is the time to prioritise dementia, and it starts with getting more people diagnosed. The charity is calling on the government to make condition a priority, and its new report that reveals just 1.4% of dementia healthcare costs are spent on diagnostic and treatment. About 1 million people currently have the condition, a figure that is predicted to rise to 1.7 million people by 2040. We're going to have 1.7 million people with dementia and their costs. That's really bad. But it's estimated that a third of people affected will not have received a diagnosis, so families are left to pick up the pieces, which result in catastrophic costs further down the line, the charity says. The majority of costs are paid for by the person who has dementia or their relatives. The value of unpaid care makes up 50% of the cost of paying for private social care, which includes nursing home or home carers, accounting for 40% of the cost. A third of unpaid carers already spend more than 100 hours caring per week, and 16% have to give up work paid to care for their relatives. An early diagnosis opens the door for emotional, practical, legal and financial advice and support, It also gives a person access to treatments to manage their symptoms and care. But Alzheimer's Society said a lack of awareness over symptoms, fragmented health and social care systems, and workforce issues, meaning too few people are getting the help they need. Yeah, this is, again, like I said, what's been happening with the NHS is hurting all sorts of healthcare departments, obviously. And dementia is another one of them. Actor Victor McCone, an ambassador for the charity, said people showing signs of dementia are now living with the condition, and now people that love and care for them are being forgotten. It's become the UK's forgotten crisis, despite dementia being the largest, being the UK's biggest killer. I've seen firsthand the challenges families face before and after a diagnosis, and having supported Alzheimer's Society to push for change for many years, it breaks my heart that we're stuck in the same place with hundreds of thousands of people still undiagnosed. An aging population means that the number of the UK's population with dementia will increase by 43% by 2040. With the biggest increase, 51% in Northern Ireland and London, 53%, the Alzheimer's Society predicts it is calling for increased access to diagnostic tests to help families avoid reaching costly, avoidable crisis points, and more research funding to boost the number of clinical trials aimed at earlier diagnosis. So this is another. This piece here is the soaring cost of dementia. Who pays what? So, the majority of costs of dementia to the UK is currently being paid by people with dementia and their families, either in unpaid care or being paid by private social care. In fact, the Alzheimer's Society study into the economic impact of the disease has found that relatives are shouldering 63% of all dementia costs. This includes the cost of giving up jobs to care for relatives and the value of the hours of unpaid care that friends and loved ones carry out, as well as the actual eye-watering cost of nursing homes or at-home carers. But what if you don't have enough money? People with dementia or their relatives can apply for financial support to pay for the cost for care from their local authority, and a financial assessment is carried out. Currently, if a financial assessment finds dementia patients' assets and wealth amounts to £23,250 or more, they will be expected to pay for all of their own care costs. They will have less than £23,250 either in assets or wealth, and then the local authority may contribute towards care fees, beyond what the person with dementia can afford from their own home. So do you have to sell your home? If the person with dementia is receiving care at home, the value of the person's home is not counted in their financial assessment. However, if the person is moved into a care home but buys their own house, the cost of the house may be included in the financial assessment, which could see people forced to sell their house in order to fund their own care home care. That's terrible. If a patient's husband, wife or partner or their independent child is still living at the home, then the cost is not taken into account in the financial assessment. So if you put them in a care home and you can't afford that pay, your house will not be covered. But if your house will be, it depends there. Will not be in your house, but if it's at home, your house is not taken into account on the costs. So two teams, one from the University College London and the other from Dementia's Platform UK at the University of Oxford, are conducting UK-wide clinical trials to identify blood tests to boost dementia diagnosis. Expert hopes that the research will leave the blood test for diagnosing Alzheimer's and other forms of dementia on the NHS within 5 years. 1 in 3 people born today will develop dementia. It's the biggest health and care issue of our time, yet this isn't the priority. It should be among decision makers. We wouldn't accept this for any other terminal disease. We shouldn't accept this for dementia. 1 in 3 people with dementia do not have a diagnosis. They are facing dementia alone without access to vital care, support and treatments. If we don't address diagnosis, we have no hope of addressing major dementia challenges that we face and reducing the costs for the health service and wider economy. Officials said the latest dementia diagnosis rates of 64.8%, an increase from March 2020, is due to sustained recovery efforts. So the Department of Health and Social Care spokesperson has said timely diagnosis of dementia is vital, which is why we are working to identify and treat more people to providing potential new treatments if they become available. We're also doubling the funding for dementia research to £160 million a year by the end of March 2024-2025. And dementia is one of 6 major conditions, including our upcoming major conditions strategy. An NHS spokesperson has said dementia diagnosis rates are the highest they have been for 3 years, thanks to the NHS staff. We have worked hard to recover services following the pandemic when people are less likely to come forward for care. NHS support affects people affected by dementia are also improving, including through providing personalised care packages. But catching it early makes it the biggest difference. So if you or your family think something is not quite right, please come forward with your GP as soon as possible. And just at the bottom there as well, if you're worried about yourself or someone close to you, you can check your symptoms today using Alzheimer's Society Symptoms Checklist. You can visit alzheimers.org.uk or call the Dementia Support Line on 0333 150 3456. Just going to leave it there for a moment for you guys if you haven't already. Pause the video if you need to for that. I don't wish dementia upon anyone, but these numbers from the Alzheimer's Society are extremely concerning, and it's very worrying to say the least. As we always say, that more needs to be done, but when you look at this piece and you look at the damage that is being caused to people, once again, like the government, the Department of Social Care, NHS are saying they're doing everything they can. And I generally believe the NHS is doing everything they can within their power to help. I really, really do, guys. I really, really do. But I don't trust this government one bit when it comes to looking after people. They have a track record of being poorly looking after our society. My hope is that Labour will have an action plan in place of some sorts. And I'm sure Wes Streeting, as much as I don't trust this man in any way, shape or form, he will no doubt would have seen this report and need to have a plan to tackle this, because 90+ billion pounds is not an acceptable figure that people should be paying out for those with Alzheimer's, for people with dementia, sorry. So it's a major issue that we have in this country, and one that needs to be dealt with in any way, shape or form. But I'd say even in the world, wherever you are, and let's hope the projections don't go in the direction and we can actually bring it down in the future. But what do you guys think? What do you guys make of these figures? What do you guys make of the numbers? Are you concerned about dementia? Maybe you're someone yourself that relies on funding from the NHS or from the state to help with your care. Perhaps you're somebody who's listening who doesn't get that, or you know of someone who is in this situation. Let me know your thoughts and more about this in the comment section down below. If you found this video informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video, and subscribe because it really does help support the channel. And if you want to go one step further, financially support me in the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble, Patreon or Facebook for exclusive content there as well. So thank you all so much for watching. I hope to catch you all very, very soon.